Thank you, Ty. More than 16 million Americans diagnosed with attention deficit hyperactivity disorder. Right now, there is a nationwide shortage of meds used to treat ADHD. Dr. Gregory Mattingly from St. Charles Psychiatric Associates is with us this morning with more on what you need to know about the medications. Good morning to you. So the FDA announced back in October there was a shortage. They kind of blamed the manufacturer, but then during the pandemic, there were also a lot more people diagnosed. So why do we have a shortage?
So I think it's twofold. Number one, during the pandemic, the rates of ADHD diagnosis went up. People were learning from home, they were working from home, and people that had cognitive problems realized, hey, I'm having problems. But then the supply was fixed. So if you have more people being diagnosed with the supply being fixed, what winds up happening is a shortage.
Yeah, how is ADHD typically treated?
Yeah, so we know that ADHD should be treated, multimodally. Part of that is medicine, but part of that also is learning skills, learning how you're organized, learning how to best be efficient with your time and the way your brain is structured. So we think of medicine as being one of the foundations of treatment along with that holistic treatment.
What's the medicine we're talking about that's in shortage right now, and are there other treatment options?
Certainly. So the main medicine that's been in short supply has been short-acting amphetamine or Adderall.
Okay.
And there's a push right now about trying to use less short-acting medicine and trying to go to once daily long-acting stimulants or the non-stimulant treatments for ADHD.
Has there been success with that?
There has been. So there's a variety of long-acting stimulants, both amphetamine and methylphenidate. We now have 4 non-stimulants, 2 of those specifically approved for adults.
So we're making progress, at least during this, to try to get away from that. Why is that important for patients?
You know, it's important because some of our old trends about just taking ADHD medicine when you think you need it, Margie.
Yeah.
That's not the best trend. You know, ADHD doesn't disappear when you're driving a car, taking care of your kids, balancing your checkbook. It's kind of with you 24/7.
Right. If you miss your medication, what will happen? What will result from that?
Yeah, you can have rebound, you can get forgetful. Unfortunately, you can get involved in a car accident or something you're not planning to do because you get distracted. So our treatments these days, we think about the once daily long-acting medicines. We think about the non-stimulants, such as atomoxetine or Qelbree, and we try to think about what's the best role of those medicines for your patient.
Yeah, how can patients work with their doctors? What do they need to tell them?
First of all, where does ADHD show up in your life? As a parent, as a student.
Right.
For a lot of my working adults, it may be, I'm okay at work because it's structured. But when I go home and I'm trying to take care of my kids, everything falls apart.
Yeah.
So where does it show up in your life? Where are you having struggles? And then talk about the side effects and the benefits you're getting from your treatment.
Yeah, and Dr. Mattingly, you said in terms of the medication shortage, that's not getting any better.
It's not getting any better. Now, I think the news is it's caused us to take a look at, is this really the right medicine for you? Is taking something short-acting 3 times a day the best option? Or do we have once daily treatments that maybe are a better option for you?
Yeah, in some ways, yeah, it's been a good thing.
It's made you re-examine what's the best option.
Yeah, absolutely. Thank you so much, Dr. Mattingly, for being with us this morning. Some great advice. We appreciate it.